Hi, my name is Antônio Mello, and I'm a PhD student at Dartmouth College, and I would like to present the case of a 58-year-old man who reported seeing people's faces as distorted for the past 3 years. Every face he encountered in daily life appeared, in his words, demonic, with severely stretched facial features and deep grooves on different parts of the face. However, he did not perceive distortions on other objects or on faces on screens or on paper. Our initial assessment did not reveal obvious signs of cognitive or visual impairments. T1 and T2 MRI scans showed a round lesion measuring about 1 centimeter in the left hippocampus. The impression here was of an arachnoid cyst, but it's unclear if this cyst contributes to the distortions, since the hippocampus is not part of the face processing network. In previous studies, it has not been possible for patients to accurately judge if an illustration of their distortions matches what they see, because the illustration itself also depicts a face, so the patients will see distortions on it too. However, as I mentioned before, this patient does not see distortions on faces presented on screens. This unusual feature provided us with an opportunity to visualize what he sees using the following procedure. First, we took a photo of a person's face in a closed room. Then we projected this photo on a computer screen and asked the person to stay in the room. Next, the patient entered the room and we asked him to look at the face of the person in front of him and compare it to the photo on the screen. As he alternated between observing the face in front of him and that same face on the screen, he provided real-time feedback on their differences, which we used to modify the photo until it matched his perception. As you can see in the visualizations, the eyes, nose, mouth, and ears are severely stretched, and deep grooves affect the forehead, cheeks, and chin. These distortions follow the face through different points of view and are remarkably consistent across different identities, affecting the same facial features regardless of the face he sees. This is a case of prosopometamorphopsia, or PMO, a rare neurological disorder of visual perception in which faces appear distorted while other visual categories often do not. We believe that visualizations of face distortions are critical to understanding PMO. They not only demonstrate the severity of this condition, but also emphasize the need for effective treatments. This case allows us to glimpse the world through the eyes of someone with PMO for the first time.